First, BDS, considered to be one of the most stressful years of your dental life. Q stressful? You have finished the 12th standard and now you want to enjoy because you're in college, but you can't enjoy because you're in a medical college. You wanted MBBS, but you have landed up into BDS, and you are in the stress of whether you should go for NEET UG again or whether you should continue your journey in BDS. You are in a college, a new place, new hostel, maybe a new city. You are coping up with food, bathrooms, toilets, sleep, so many things. Your well wishers are telling you dentistry has a lot of scope. It's the best decision you have taken. And some well wishers are saying, why have you chosen dentistry? There is so much competition, there is so much saturation, and it's not a good decision. You see your school friends enjoying in degree colleges, going to cities, traveling, going to fests, and you can't do most of it. You collect teeth for preclinical exercises which you don't understand why. You are carving on a wax block and you don't understand why you are playing with wax or why you are asked to put your finger impression in a plaster. You have never done any drawing and now suddenly you are asked to draw histological specimens with pink and blue colored pencils. Relax. We are here today at DBMCI MDS to help you sail through this difficult journey of first year BDS. Welcome to this special session, specially curated for all of you, where we are going to tell you how, with the right approach, with the right guidance, you can sail through this difficult year and understand how this is a very, very important year in your clinical journey and in your career. Dentistry is one of the most evergreen professions where, if the skills are acquired at the right time, it can pay you off like anything. And in this panel discussion today, I have with me four faculties, four guests, or three guests along with me, who are going to help you in your first year of BDS in every aspect. So, quickly, let me welcome one by one. First, we have with us Dr. Pooja Johari. Welcome to the session, ma'am.
Thank you.
So, Dr. Pooja is a doctorate in biochemistry from Patiala. She's been teaching biochemistry to many medical and dental students since 2003. She's been teaching not just in India but abroad also. She has her base in Kyrgyzstan and India. She is extensive knowledge of the trends and patterns in NEET, and it's a non-stop effort from her side to make biochemistry a very, very interesting and scoring subject. So, ma'am, welcome to the sessions.
Yeah, my pleasure.
Okay, along with Dr. Pooja here, we have Dr. Abhirami. Dr. Abhirami is an alumnus of the prestigious Madurai Medical College and CMC Vellore. She is a physiology expert. She is an author of multiple books in physiology. She has a teaching experience of many years for both medical and dental students. She specializes in urophysiology and she's also our original guru in physiology. So, welcome to the sessions, Dr. Abhirami.
Thank you. Thank you so much, ma'am. Happy to join you.
And our third guest is Dr. Ami Raval. Don't confuse, she's not a model. She is a professor in dental anatomy, dental histology at People's Dental College, Bhopal. She's been teaching BDS and MDS students since 7 years, and she's also our original guru for the subject DADH. Welcome to the session, Dr. Ami.
Thank you, ma'am.
All right. So I will start with you, Dr. Ami. This is a question common to a lot of BDS students that, and I'm going to put it directly to you. Why
Sure.
did you choose BDS?
As all of them choose, we give our NEET exam, then we wait for our results, then we wait for our ranks, and then based on our ranks, we get our colleges, right? So I was getting an BDS college, so I preferred BDS only. I didn't think of taking a drop. As I was getting admission BDS, I thought whichever field we choose, we should excel in that field only. So
Absolutely.
I took BDS as an opportunity, and now BDS I have done MDS also. And in whichever field you are, I think you should have a post graduation also in that field, so you can go ahead with your post graduation also.
All right. So now that you have been into the BDS and MDS for such a long time, what prospects do you see? So a first year बच्चे को उसको क्या क्या पता कि what are the opportunities after BDS? What all can he get after BDS? What all can he
Okay,
do?
first, so you can go for post graduation, and foremost, you can establish your clinic, because clinic gives everything you need. Right, this is basic settlement for a BDS as well as a MDS student. Then you can have other options also. You can get government jobs. You can apply for exams, UPSC exams, and you can apply for army exams also. You can go for army jobs also. So there are many prospectors. Some students are going for MBA also. There's another option also. So don't think that you don't have any future in BDS. Your relatives might be saying that अब क्या ही ले लिया, आगे क्या करोगे? ऐसा नहीं है. अगर आपने लिया है तो उसमें आप एक्सेल करो, आप खुद को झोंक दो, तो आप कर पाओगे.
Right. So as a dental surgeon, you can be a job creator, just like Dr. Ami said. You can watch these
And
recent
academics
videos.
also, you can go for academics also
Yes. So
along with your
academics,
clinical practice.
clinic, government jobs, armed forces, public service commission exams of dental officers, and many other options. You can watch the recent videos we've uploaded on the DBMCI MDS YouTube channel from Dr. Shikha, Dr. Viren, who have set up a practice of lakhs and lakhs of rupees. So these are the prospects as per Dr. Ami. Dr. Pooja and Dr. Abhirami, this is a question for you. You have seen both MBBS students and BDS students. You have seen the
Yeah.
curriculum also. So, starting with you, Pooja ma'am, what is the difference in the students' mindset and what is the difference in the syllabus of both these students?
See, if we talk about the syllabus as such, right, syllabus is more or less the same, but yes, in MBBS, we have to go into the depth of the subject.
Correct.
Okay, in BDS also, like it depends, it varies from student to student. I have taught so many students who really want to go inside the depth of the subject.
Hmm.
Because I would say, whatever subjects are introduced in the first year, they are the basics.
Hmm.
So whether it is anat, whether it is biochem, whether it is physiology. So all the three are integrated with pharmacology and with medicine. So be it a MBBS graduate or a BDS graduate, all these subjects are very important.
Right.
And nowadays, if we talk about the profession also, suppose if a BDS student, if he has a solid knowledge in the basic subjects, right? So obviously he can explore more. And if we talk about nowadays, again, I would come up, see recombinant DNA technology. If we talk about the biomarkers and all, any BDS graduate can go for that. So
Correct.
there is a difference, no doubt, in the syllabus, but I have still seen BDS students who are craving for knowledge.
Correct. So, according to you, research is also one of the prospects that you can do with even
Exactly.
subjects like biochemistry.
Research is there and academic. Nowadays, so everybody is going for teaching. So teaching ke liye to BDS student can also teach. I mean, like pretty
Correct.
good. That again depends upon the knowledge, how much a student is gaining. So now
Correct.
knowledge has no barrier at
Very
present.
true. Very true. What do you have to say, Dr. Abhirami?
Yeah, thank you, ma'am. As far as the differences in the curriculum, usually dental students, whenever they enter into physiology, we cheat them by telling them that you are going to learn only everything related to head and neck. But actually, it is not the case. In anatomy, though it applies, but in physiology, we can never stop with head and neck. But whereas in MBBS curriculum, if you see, the students dig into the subject starting from head to toe, the entire systems are covered very much in detail. Although head and neck only is very important for dental students, we just can't stop with that as far as physiology is concerned. So what we do, we correlate the entire syllabus of physiology more towards the focus of everything treated towards the dental subject. See, for example, medical students learn the entire respiratory physiology, everything about the lung. They go too much into the volume, pressure, changes, curves, and all that. But as far as dental subject is considered, so that part is not so important for these students. What is important for our dental students is the knowledge of respiratory diseases, which are more related to periodontal medicine. That is what is more important. And for example, if you take GIT, gastrointestinal physiology, we learn more about saliva and its secretion, whereas in medical they learn the entire subject of an entire chapter of GIT. So it's too much there. But whenever it comes to dental GIT, so we are more focused about the mouth and the teeth. So anything related to the endocrine or GIT or neuro, for example, in neurophysiology, medical students learn almost the entire nervous system, spinal cord, brain, and every part. But when it comes to our dental students, taste buds, taste pathway. In neurophysiology, we can just bring it down or narrow it down to a more narrower path, which with all the paths leading only to the mouth, tongue, and your teeth. So that is what is the difference between learning physiology in MBBS curriculum and in dental. But I can tell you that only if you are able to understand the basic physiology well, you will be able to analyze all this when you learn pathology, pharmacology, or medicine. Unless you understand physiology, I can tell you learning pathology, pharmacology, and medicine becomes too hectic for you. So please try to give more importance for physiology as a subject, not only for answering questions from physiology, but it will also take you a long way to clinical medicine also. So that is what I wanted to tell about this, ma'am. And the other thing is, yeah, fine. Thank you, ma'am.
So I think Dr. Abhirami has pointed out a very, very important point that, normally we say that you become a specialist only if you do MD or MS. Whereas if you talk about BDS, that itself is a specialist degree, right? Because since the first year, we are specializing more of the head and neck. Having said that, Dr. Abhirami says that you should learn the whole systemic physiology, not just the head and neck. You should learn everything. But obviously the focus is more on the oral and the things around the oral cavity. So already you are a specialist from first year. Your focus area is one system, which is the perioral region. And remember, it's a step ladder. You can't jump to second year pathology microbiology without knowing physiology. So you have to know normal physiology before going to abnormal pathology. So thank you for that insight, Dr. Abhirami. So if we have to understand, let's start with Dr. Abhirami. What are the most, see, because physiology is something they are learning from class 12. And it's very interesting. They like physiology. Most of the students love physiology because they have a good background knowledge. They have some baseline knowledge. So, what books would you recommend in the first year? And what clinical exercises should they do? How should they go about the whole subject of physiology?
Yes, ma'am. The standard reference textbook, as far as physiology is considered, it's always for dental as well as medical, it's always Genome and Guyton. So, if you want to understand the subject, really, if you want to understand the subject, I can say Guyton is an excellent book. It's just like reading a story book. You can never say that I didn't understand something from Guyton. So there's not a single page in Guyton which you cannot understand on your own. You can just read it and you can just understand. But the problem here is it's highly volatile. You can't read Guyton, and if there's a question asked in your exam, you cannot recollect points from Guyton and you cannot give it out in your exam. So that's the problem with reading high-end textbooks. So as far as your exams are considered, we have other Indian author books like G.K. Pal, A.K. Jain, or Chinmalingam, especially for there's a book which has been made only for dental students. So these are some of the preferences for textbooks when it comes to exam. But always remember, these are all like a notes or a guide only. They can guide you through your theory exams. But if you want to understand the real physiology, it's better you give some time for reading books like Genome or Guyton. Genome also, it might be difficult as a first year student, but Guyton, I can say it's a lovely book. All first year students can happily read Guyton. So that is one book which has to be there in your bookshelf.
Is it also useful for the clinical part of physiology, the lab physiology?
Yes, ma'am. Yes, it's also useful for clinical part because in clinical part, I think in practical exams, dental students, they mainly focus on recording pulse and blood pressure. So pulse and blood pressure are basic theory topics only, which are taken to the clinics. So only if you know the definition for pulse, what are the pulse waves, you understand how the heart is beating, how blood is flowing out of that, and what is creating this pressure. Only if you know the theoretical basis of all this, you can record BP for a patient. Practically anybody can do that. Even a machine does that. But if you want to really interpret the values and make diagnosis, with basic understanding from Guyton is very important, ma'am.
All right. Okay. So, Dr. Abhirami, you also teach physiology to the first prof students of BDS, right? What is the right time to listen to your videos and read to the notes? When should they do it? Before doing the text or after doing the text? What do you think is the right time?
Yeah. I think for all dental students, there are classes running in your own colleges also. So, for example, we start with general physiology and then we move on to blood physiology. So, in general physiology, so if the classes are currently your teacher or professor in your college is teaching general physiology, so you observe these classes. And once you observe these classes, you will have an outline to what is general physiology. Then you come back and you watch the videos. So when you watch the video, you will be able to understand the way subject is taught when it is only focused on theory, and the way subject is taught when we focus on theory as well as your NEET PG entrance exams. So you will be able to identify that difference. So you get the outline from your professors in your own college, you attend those classes. And after that, when you come back and watch our videos, definitely you will be able to understand how a topic which is taught in the theory class of physiology is taken to the clinical side here, and how it is made in the form of an objective question, an MCQ question, and how you will be able to remove the distractors and get into the right answer. So that's the way you process with this. And most important, please have your own handwritten notes. Do not copy notes from your friends. That will never ever work for you. You have your own handwritten notes when the teacher is teaching in your class, or when you watch our videos also. Even though notes are available, you have your own handwritten notes. See, sometimes because you might have written something about blood pressure on the last line, a very important point on the last line of a particular page, and it might have gone wrong. So what you would have done, you would have scored it, and you would have written the point again. I can tell you, my students have told me that, ma'am, when I went to the exam, there was a question from this point. I just remembered that page, ma'am, where I just scored that line and I've written it again. So that's how I was able to remember. So please remember, you don't copy notes, don't take Xerox from any other seniors or anybody. As far as possible, write your own handwritten notes. Definitely that will take you through a long way, both for your first year exams as well as NEET PG exams.
All right. Thank you so much, Dr. Abhirami. Now we come to the second subject, which is biochemistry. In dentistry, usually it's combined together, physiology and biochemistry. So, ma'am, it's considered to be a very factual subject. It's a very scoring, but a very, very factual subject with a lot of data and a lot of things to remember. How do you think should be the approach to biochemistry? What are the books and what should be the approach?
Okay, first of all, see why you have to have a positive mindset. This is what I want to tell the students, because they've been studying chemistry since class 9th.
Correct.
Okay, biochemistry is nothing but it's a chemical reaction that is taking place inside the body. So, what I do is if I am teaching a first year student, I simply start with the basics. Just say, for example, I'll give you just a phosphorylation is there. Okay. And if I'm saying glucose is there, if it is phosphorylated, it is going to form glucose 6 phosphate. So if you know the chemistry behind that, it will be easier for you. Because generally, what students say when they pass out, they say biochemistry is a very volatile subject because they try to cram all the things.
Correct.
Okay. So if you try to mug up all the things, it is difficult. Just as suppose, if I take again the spellings are very important. If I talk about phosphatase and phosphorylase, student out of anxiety, simply say phosphatase. We know the difference, so we have to, being a teacher, we have to tell them. First of all, you need to have a solid knowledge of chemistry, and it is a well-known fact. If a student from class, like from first year, start building that foundation, biochemistry will be very easier for that student to understand.
Right.
And
Right.
coming over the books, it's like Harper is the Bible of biochemistry. Okay, so Harper is like, but yes, if a student is finding a problem in understanding, because we all know we have been studying through foreign authors, and foreign authors write very crisp and very clear. Just Dr. Abhirami also said, Guyton, it's like a Bible, like Gray's Anatomy, it's like Anatomy ka Bible. Okay,
Correct.
but yes, if they are unable to understand, so there are so many books. Like you can say Dinesh Puri is there, then DM Vasudevan. There is one special book written by DM Vasudevan. It is for dental students only.
Yes.
Similarly, Satyanarayana, it's like well known this. So students ultimately they go to Satyanarayana only. But yes, if they start cultivating, it's like cultivating a base from foreign authors. So they won't find any problem because foundation is very important to crack NEET exam. That is there because by the time they start going to the clinicals, they start forgetting the basic subjects. This
Great.
is
So,
what I
what
have.
is the importance? How do you relate biochemistry to the clinical sciences?
So many examples are there. Suppose I'll just give you one common example. If a person comes for extraction, isn't it? Obviously, you're going to take the history of that. If the person says he's diabetic, the story finishes here. Okay, so you have to monitor that. Again, I mean, like for dental students, it is a basic
Correct.
thing. Suppose if a BDS wants to, plunge into a field of dietetics and nutrition, which is nowadays very upcoming.
Yes.
So biochemistry, a person cannot become he cannot advise a diet without studying biochemistry.
Very true. Very true.
This is one common example because nowadays students are getting confused. Suppose if they don't crack NEET PG, so instead of demotivating them, we should tell them other spheres of life also. Yes, there are so many other things which they can opt for. So life
Great.
has no restrictions as such nowadays. So be it biochem, be it physiology, they are like the mother of sciences. That is why they have kept in first year also. So it's like
Yes.
that hierarchy goes on. And at biochem physiology, then micropatho is there, then medicine is there. Just a
Great.
surgery they cannot learn without knowing anatomy.
Very
So
true.
everything is like, it is going up. It is like just say we use iPhone. So it's like an upgraded version. Just say 16 Pro is there, 17 Pro is there. Some things are added up.
Correct.
Yeah.
So,
So
ma'am,
regarding
if a student asks you that, okay, I have to first clear my first year
yes.
of BDS, I have to clear my theory exam, I have to clear my viva. So, how should I study? In how many days can you help him finish biochemistry?
See, if a student has, I mean, little bit of knowledge, that again depends on the student. We have a capacity to finish biochemistry in 3 days. In a regular college, we finish the same subject in 365 days,
Right.
isn't it? But just like this, Dr. Abhirami said, whenever we are delivering a lecture, the student should write everything with his own hands. Because
Correct.
nowadays, you know what the student is doing. If we are delivering a Zoom session, they'll just relax on the bed and they are listening to the lectures. That is not the proper way. When a
Yes.
teacher can deliver the lectures properly sitting, so they should also sit and they should write with their hands. They should
Correct.
not do the copy paste. Copy paste wala that habit which is cultivating, it is very bad, and they are
Mhm.
having access to so many things. So they should use this social media as a merit, as an advantage. This is what I feel.
Right. Okay. So, thank you for that insight. So, now you guys know the important books in biochemistry. So, if I talk about anatomy, so I am an oral and maxillofacial surgeon, and like Dr. Pooja said, no surgeon can operate or
Yes.
can do surgery without knowing anatomy. So, I'm going to talk about the important books in anatomy and how you should approach the subject. Very quickly, I will. So this is, I hope, is my screen visible?
Yes, yes.
All right. Okay. So, okay. So these are the most important books. See, we all know that Gray's Anatomy is the standard book in anatomy. But like Dr. Abhirami said, that you can just read Guyton and it's a very simple book and said very easy to understand. I will not say the same thing in anatomy because it is very, very vast. And head and neck is what is most important to us in terms of professional exam, in terms of viva, in terms of any entrance exam in the world, whether it's a foreign university exam, whether it is NEET PG, whether it is INICT, whether it is any government exam, whether it is army, whatever you exam you are preparing for, What is most important in anatomy is head and neck. Okay, and the standard book for you guys at this level, I would say, is BD Chaurasia's Human Anatomy. All right, it is a 4 volume book which has the third volume as head and neck and orbit. That is the most important resource you have. Apart from that, when you're going to your dissection halls, when you're going for dissections, Cunningham is a very, very good book for dissections. You can read Cunningham. There are many other books available as I have shown here, but Cunningham is a very systematic book where you can learn layers, how to dissect, and everything. Next, in anatomy, we have osteology. So, both osteology and embryology, Indrabir Singh is a standard book which you can read. Histology also, IB Singh. Histology is very good. Stevens and Lowe's is also available. If you have the capacity, you can read it. Otherwise, IB Singh is standard. Embryology again, IB Singh. And if you have the capacity, Larson's is a very good reference book from which you can have a very good idea of the images and you can read anatomy. Now, this is about basic what you have to read. In anatomy, we also recommend you to see anatomy as an image. Okay, because anatomy is one thing which you can touch with images. If you have an atlas, like a standard Frank Netter atlas, or nowadays very, very easily available are 3D atlases, like anatomy 3D and kenhub, zygote body, visible body. You can just download these apps in your phone, and three dimensionally you will have the organ, you will have the bone, you will have the system in front of your eyes. You can rotate it as much as you want, and you can watch live anatomy things the time you want. So I will really, really recommend anatomy should be understood with images. Bina images ke, bina 3D images ke, you should not study anatomy. It will be boring. It will be difficult to remember. It will not be, you will not be able to correlate things. When you are studying bones, when you are studying osteology, if you have a physical bone with you, okay, most of the colleges have this running in their hostels. Okay, there is one femur, there is one clavicle, there is one maxilla mandible, there is a calvarium which is there. Your seniors have it, the seniors will pass on to you, you will pass on to your juniors. So it is usually there in the library or in the hostels. Please take these bones with you when you are reading anatomy. Look at those trochanters, look at those attachments of muscles, they are marked there. Use physically, use the bones so that you are able to understand anatomy. Anatomy is not something to learn. Anatomy is very, very interesting if you understand and try to correlate clinically. All right, one last reference book which I will say is Gray's Anatomy. Many versions of Gray's Anatomy are available. There is a big comprehensive version, there are abridged versions, there are short books of anatomy, handbooks of anatomy from Gray's Anatomy available in the market. You can have it as a backside reference. And apart from that, a lot of websites are also there to teach you anatomy. A lot of lectures are available. The DBMCI MDS gives you a lot of great quality anatomy lectures which will help you to understand anatomy clinically. All right, I will just give you one example. Okay, we have all seen that when we have cold, when we have any viral infection or cold, our head starts paining, our sinuses start paining. So we have read in anatomy that there is a maxillary sinus here. Okay, but we never correlate it to our studies. We never correlate our studies to our clinical knowledge. So next time when you read about the maxilla and the maxillary sinus, the frontal sinus, the ethmoidal sinus, understand it. And understand that when there is cold, when there is sinusitis, when there is general respiratory infection, this lining is thickened. The physiology of the circulating fluid in the maxillary sinus is blocked. The hole which drains the sinus is blocked. So this is how you correlate anatomy with physiology. Then when you put those Otrivin nasal drops in your nose, what happens? It is a decongestant. So pharmacology, that decongestant is shrinking the lining of the sinus. Because of that, the hole which was blocked, the hole gets opened. And all the fluid in the sinus is now able to drain. So your headache is gone, your clogging, your heaviness in the sinuses is gone. So anatomy correlated with pharmacology, medicine. Okay, you might not be able to understand everything in the first year, but like I said, BD Chaurasia has paragraphs which have clinical pearls or clinical correlation. Please understand those clinical pearls. It is very, very important, and you will start loving the subject when you know how in practical life you can correlate anatomy with your clinical medicine. Okay, so these are the books. And Dr. Ami, would you like to highlight that in anatomy also and in DADH also we draw histology,
Yes,
we
ma'am.
take HNE pencils and we draw the the histological specimen drawings. Why do you think it is important? Why are students made to do it?
Because the cells play an important role. If they cannot differentiate the cells, they cannot differentiate the pathology. As ma'am Pooja Johari ma'am, as well as our physiology ma'am Abhirami ma'am has told, that it forms the base, right? If they do not know what is normal, they cannot differentiate the pathology. So they should first know which cells are normal. When they differentiate, what will be their shape? After differentiation, what will they lead to? Because some cells may lead to tumors also. Differentiating some cell risk may lead to cyst also. So if they do not know the basic cell which are involved in the formation of a dental tissue, they cannot differentiate the pathology, right? So same way, first we make them to draw diagrams, because mainly we have our connective tissue and epithelium only in the slides. Mostly for soft tissue, and for hard tissue we have enamel, dentine, pulp, based on the ground sections. So if we do not know the microscopic structure, that are mainly they are the background performers, right? You cannot see them with a naked eye. So we use a microscope, and based on that we differentiate the cells, normal cells. And then if this normal cells differentiate, they may lead to pathology based on the other etiologic factors.
So I think
So
drawing makes them remember that easily, that these are the
shape
shape
of the
of normal
cells,
cells. Yeah.
yes.
Same way for carving also, because as a first year I used to wonder, why am I carving the tooth out of a wax block? Why is it important?
To identify the morphology of the tooth. Mainly, dental anatomy is a subject that is related to the identification of morphology of the tooth, as well as the function of the tooth, which with the tooth in the same arch, as well as the opposing arch, which say as occlusion, right? So mainly this connection between the teeth, their function, their identification. Again, this is the base. Now, if we have caries, right? Then we prepare a cavity, we do filling. But if we do not know the proper morphology of the tooth, how will we make it again the same? How will we appreciate the fossa or the cusp if we do not know this tooth has two cusp or three cusp, or central groove or a fossa? So based on these features, you can, again we have a clinical correlation. If we cannot make a fossa or a cusp, then our proper occlusion will not be established, and again will patient will have difficulty, and he will go to another dentist. In this competitive world, you will be lacking behind, right?
Right, very true. So what are the important books in DADH that first year BDS should read?
Ma'am, books are very basic. We know Orbans for dental histology. You can also refer 10 kids. 10 kids is also a good book, and Orbans is the base of dental histology. And in dental histology, you get very straightforward questions, both dental anatomy also and dental histology also. Whether being a long question or a short question, you do not get a very difficult question. You know that this topic is important. This will come as a long note. This can come as a short note. So prepare that way. From Orbans, you can definitely get your answers, and you can refer our videos also. So first you can go to the video section. You can get an outline of the chapter. Then you can read your book. Then you can make your notes, and you are ready for your examination.
Okay. And dental anatomy, Wheelers for dental anatomy.
Yes, for dental anatomy.
All right. Okay. Do you think a first year BDS should also be seeing X-rays of the primary, secondary dentition? Do you think that will help?
Sure, ma'am. I think it should be included in the curriculum also, because they can differentiate the morphology of permanent dentition from a primary dentition. Actually, they have a chapter also on that difference between primary and permanent dentition. So usually a first year student, without seeing the primary dentition, just mugs up the differences, right? He cannot visualize what is primary tooth, what is its shape. So if we make them use x-rays, then it is better for them. Even the structure of the teeth, what is radio opacity, what is radiolucency,
The basics of the X-rays should be told them.
in
All right.
inorganic matter.
Correct. Okay, so I think, ma'am, the biggest fear in a BDS student, in a first prof BDS student's journey is viva. Okay, he's the last viva he has given is a 25-mark exam in 12th standard, which he has managed to pass, and now it's a 100-mark full viva, which is which is a nightmare. So, starting with you, Pooja, ma'am, what advice would you like to give to our students that how should they prepare for viva?
See, that again depends on the teacher. Suppose if we are teaching one subject, so we should first of all give them the basic points, what are important, and again, what is the practicality of this. Along with that, we should make them practice some 5 to 6 viva type of questions. This is what I feel, because again, in biochemistry also, if they have to study, there is a very good book in practical biochemistry by Ranjana Chawla. So there, the practicals are given, and in the end, some viva type questions are given. So whenever we are conducting the practical, when we are telling them to perform, after that we can practice them, make them practice. Ki just these type of questions are asked, and in biochemistry it is a set type of some questions are asked. Just suppose abnormal constituents of urine. So they should know ki what are the main three abnormal constituents of urine, what is renal threshold. These are the basic points which they should. And this is again wholly solely the it lies in the hands of the teacher how they make them practice.
All right.
So
So a
this is
good
what I
teacher
feel.
help you, overcome the fear of viva.
Yes. Yes,
Very
yes, yes. Especially in biochemistry, though.
correct.
Yes.
Very true. I used to dread biochemistry. I mean, I've hardly studied biochemistry in my first year, and it was my drop year after internship when I had to go back and study biochemistry altogether because it was an important subject for all exams.
Till now, also, even if I'm teaching, MBBS students, also, I don't know why they are scared of biochem. In fact, I find anatomy to be much more tougher. Biochemistry is suppose if you are eating carbohydrate, what is happening inside your body? This is so simple. So
Correct.
biochemistry and physiology, still one can understand. Anatomy is just we have to mug it up. But still they find biochemistry is like, terrifying subject. I don't know why. Even I fail to understand why they think like that. For a
So
teacher
good
also, it
teacher
becomes
is
difficult to
your
justify.
solution. Good teacher is your solution to a neat viva in biochemistry.
Yes,
Dr.
yes,
Abhirami.
yes.
Yeah, ma'am, Viva exam, I think it's all about testing your communication skill, which we call it as EdCom in curriculum nowadays. So it's more about testing your communication skill rather than your knowledge. It's all about how you are able to face the examiner. What is your attitude when you talk to a professional, and how you are able to concise your answers, not just blabbering something or talking something which is not at all related to the question, because it's like a one question you will have one sentence just to answer. What is this, what is that? You just have to say what is this and what is it. It's not an essay type of question. So I think you
Correct.
have to stick to the point and be more relevant, avoiding over elaborations, and most importantly, admit when you don't know. Rather than answering something which is nonsense, you can just tell the examiner that I'm not sure about the answer. I haven't learned the topic, because any examiner will appreciate your honesty combined with your willingness to learn. So it is not about who answers more number of questions. It's not a race where you get where you compete with everybody. So it's a one-to-one contact with the examiner. So be as polite as possible, as good as possible in your exams, and try to answer in a more professional way. You make your engagement and interaction with the examiner in such a way that they are able to accept you as a good medical professional. It is not about the points that you say, it is all about your communication with the examiner.
Very, very important points you said, Dr. Abhirami. You also said that you should be crisp and to the point and not, kind of beat around the bush. For this, do you think solving the questions, the MCQ type questions, do you think that will help them, narrow down their answers? And do you think it will help them in their vivas, doing question banks?
Definitely. Yeah, definitely, definitely, ma'am. Because that's a very valid point that you said. Whenever we go through these MCQ type of questions, most of them are one-liner questions. And what is asked in the Viva exam is also of the same type. Mostly it is a one-liner. What is this or what is that? We're not going for any long, elaborative answers. So whenever you are very well focused with your NEET PG exam questions, or if you want to be on the higher edge INI MDS questions, so definitely the basic questions, the first few questions, maybe if the examiner is asking you 10 questions for one student, the first 6 or 7 questions will be from, mostly it will be from NEET PG pattern of questions. If you are able to answer all that, the last 3 questions, the 8th, 9th, and 10th question will be from the INICT pattern of question. So they are like
Correct.
testing you in the order. First 2 questions, are you good with the basics? The next few questions, are you able to answer the neat pattern of questions or the neat type of question? I'm not saying it is a neat question. It is the similar topic or similar understanding. And the last few questions where they are testing you on the highest edge, they want to give you distinction or honors. So the last few questions are always for that. And the other tip, when you attend Viva exam also, don't get panic if the examiner is asking you more number of questions. Who will be asked more number of questions? Only the student who is answering the first 7 questions very well will be asked the 8th, 9th, and 10th question. So if you are asked more number of questions, it means the examiner is very fond of you. He is liking your answers. He is trying to grab more and more from you. He wants to give you more marks. So never get panic in any type of exam if the examiner is digging into more number of questions. You just try to stay calm and answer more number of questions. The more you answer, the more you get marks in your exams. So don't worry about the number of questions being asked in your exams.
Very true. Dr. Ami, lot of times students ask us that, should we start our NEET preparation in the first year or should we focus on the university exams? I usually tell them that the preparation is broadly the same. You have to study the subject as a baseline, right? And additionally, if you have time, if you can find it in your timetable, you should do some questions. Do you think that applies in DADH also, and that doing questions from the question bank will help them in their viva and the NEET exam later on?
Definitely they will help, because as I always say, it is a straightforward subject, right? You get straightforward questions, numerical questions, as well as one liners. Also, you have a direct line from book from DADH as well. So if you prepare well for theory, it will help you in your NEET exam as well as for viva also. So it will definitely help them for their NEET preparation if they prepare their theory well from their first year only.
Okay. All right. So that was a good academic discussion with all of you, ma'am. On a lighter note, I would just want to ask that how much bunking is allowed in first year? How much can you bunk your classes and practicals to allow yourself passing marks or good marks and having a good knowledge? पूजा मैम आप सबसे सीनियर हो, आप बताओ कितना बंक कर सकते हो? बिकॉज मैंने बहुत बंक किया है. आई हैव जस्ट प्रेड टू गॉड इन द एंड दैट प्लीज पास करवा दो for first and second year. मतलब they're the most bunking students at the current scenario when everybody is very competitive. हमारे टाइम में तो हम सोचते भी नहीं थे कि we have to do MDS or something like that. But now students think, which is a very good thing. They've started thinking from the first year only that they have to make a career very soon. So, but they have to enjoy also. So, how much balanced? How to create balance? How much can you bunk?
See, one should enjoy each and every phase of life. This is what I feel. Even if you are ready to bunk the classes, because life, it never comes again. But yes, keep your goal focused. This is what I feel. You are bunking the classes, you are roaming, do every damn thing, because life is not going to come again. But yes, give priority to your studies. If you focus on your goal, so nothing can do. कहते हैं ना कि जब आप कुछ करना चाहते हो तो सारी कायनात आपको मिलने के लिए वो कर देती है, तो you should be like that. And regarding the preparation of NEET, I think first year is the foundation year. अगर आपको पता है, if you have taken admission in BDS, first year से if you keep your goal focused, आराम से पढ़ो, so I mean, like, there is no power which can stop you from clearing. हाँ, मस्ती भी मारो, बिकॉज प्रोफेशनल लाइफ बार बार तो मिलेगी नहीं। बाद में ये ना हो ना, अरे मैंने ये मूवी नहीं देखी, अरे मैंने ये मूवी नहीं देखी, अरे डू एवरी डैम थिंग, जस्ट एंजॉय लाइफ, बट यस स्टडी ऑल्सो।
Very true. Dr.
Yeah.
Abhirami, lot of students who are in hostel, they are away from home. You have been in Madurai and in Vellore, and a lot of students struggle with, relationships with their friends, with their family, financial issues because, they are not yet earning and they will earn in internships. So, how do they want to exercise also because till 12th they thought ki chalo main fir gym start karunga, and how do you think they can create a balance in their academic and this non academic parts of life which are very important?
Yeah. As a dental student, um, I think when you are very hardly trying to drill into your teeth as a physiologist, so I would help you to drill into the science of life, where when you start off your day with a good positive thought, with a small warm up, a small meditation, a simple time that you spend with the nature or with a god. So whatever it is, whatever you like, whatever your heart says, wherever your heart goes, just be there and just try to stay calm, because nowadays the biggest problem students are facing is not about learning the subject. It is the student who has learned all the subject but is under high pressure and who is high stress and was not able to replicate all that in the exam. See, I have seen students personally. I have connected with students who just have a superficial knowledge of all the chapters and all the subjects, but their minds are so free and the mind is so happy that whenever they go to the exam, even if they're not able to answer all the questions, whatever they have learned, if there's any question from the portion that they have learned, they will be able to answer it in a complete way, rather than studying everything, taking too much of stress, and at the end of the day forgetting everything. It's not about how much you learn, it's about how well you learn the subject. So don't concentrate on covering all the topics, all the chapters, all the questions. It is not about that. Even if you are able to cover only 80% of the subject, it is okay. But keep in mind, any question that is asked from the 80% that you have learned, you should be able to crack it 100%. So that is what is more important, because nobody will be able to cover all 100% of the subject. As a physiology professor, even if you give me a question paper of 100 marks, I won't be sure that I will be able to score 100 out of 100. Definitely, I won't score. I cannot score. Even after having a thorough knowledge of the subject, that cannot happen. So, as a first year student, don't take too much of stress to learn more. It is not about learning everything that comes in your way. It is about grabbing the most important things, the high yield points, and how you are able to replicate in your exam. So, and also about the time management, I think if you are able to complete all your work within a stipulated period of time, that is what is more important. What my professor used to say when I was working in Christian Medical College, CMC Vellore, actually our office hour, it closes when I was a PG student. The office time close, department closes at 5 o'clock. Sometimes, if I have at 5 p.m., if I have some work, what I used to do, I used to stay till 6 o'clock and I used to complete that. She used to scold me very badly and she used to say, if you are not able to complete the work which has to be completed by 5 o'clock and you are taking 1 more hour to do that, it shows your inefficiency in time management. So, what she used to say, you quickly finish your work by 4 o'clock, 1 hour, you take a break, you go anywhere, you go just have food, have fun, and you come around. And that is what is like strongly, I perceive that very strongly. So it is not about extending your time studying more or working more. It is about time management, where within a stipulated period of time you try to complete everything and keep more time for your own work, for your own hobby, and spending time with your family, call your friends, go out. You can do all that. Only work and no play will definitely make you under high pressure. So please don't do that. From your first year onwards, have a good time management. If you don't follow good time management, then only you will be pushed to be under pressure.
It's a very, very important point which Dr. Abhirami has said. Once again, time management is very, very important, and a lot of us don't know how to manage time. So, to help you with that, I have here a prospective timetable, a sample timetable, which you can follow if you're a BDS student here in India. most of your college hours is 8 to 4, 9 to 5, or 9 to 2, depending on which state you are in and which college you are in. Whatever happens, your college definitely gets over by 5 o'clock. Okay. And this is one thing which you can do: 5 to 7, 2 hours. You can just explore. What is explore? You can try out new things in life. You always wanted to dance, so you can dance. You can go to dance classes. You always wanted to learn how to ride a car, so you learn car lessons. You have car driving lessons. You want to enjoy, you want to go swimming, you want to relax. 2 hours, just give it to yourselves, because 9 to 5, you have been studying in the college, you have been doing theory, practicals, this and that. Then, just for 1.5 hour, if you can just give to your studies, it is more than enough. I mean, if somebody does 1.5 hours of study every day, you can be a university topper. There's no doubt about it. All right, just make a timetable like 7 to 7:30 I will do anatomy, 7:30 to 8 physiology, 8 to 8:30 biochemistry. Next day you will do DADH, anatomy, physiology. Like that you will be able to do all the subjects 3 times in a week. On a Friday you can, revise whatever notes you have made or the DBMCI notes, and whatever you have read from college in that week, you will be able to revise that, understand that very nicely. A very simple way of doing it is, you can read a topic, whatever your teacher has taught you in college, you can come back and read that topic from the standard books. Just like Dr. Abhirami, Dr. Pooja, and Dr. Ami have told you what are the standard books, I have told you the standard books in anatomy. Come back to your hostel, come back to your home, read the same topic which is taught to you from the standard book. Now, after reading the standard book, there might be some loopholes, there might be some doubtful things. Go to the app, watch the video of that topic. That will help you make things crystal clear in your mind. Try to solve questions, because ultimately in viva it is the bang on question. The same examiner is setting your university paper, the same examiner is making questions for any entrance exam. So the questions are broadly the same. Try to solve those questions, like in what form this knowledge can be tested, किस तरह से ये question आपसे पूछा जा सकता है. So just randomly you can sit, read the topic from questions from that topic, and that will help you revise that topic in just half an hour. All right, so after doing that on a Friday, you can revise everything. Just take half an hour and do a quick revision of whatever you have read. Saturday, you can just chill, watch a movie, enjoy, go party, do whatever you want to do. And Sunday, just for 1 hour, just any 1 hour on Sunday, it's 24 hours in a day, just 1 hour, take a small quiz. Okay, take a test, take a quiz. Millions of apps there in the internet. You can use the DBMCI MDS app. There is a free quiz every day on the Premier group, in the Telegram group, in the app. Just take a small quiz. Or in the every month we have a subject wise test. Just try and attempt that test. Okay, it will open your avenues. It will open your eyes कि exam में पूछते क्या है. Maybe you are not able to solve even a single question. It's absolutely okay. If there are 10 questions, maybe you have 9 wrong and only 1 correct. That's absolutely okay. It will tell you what kind of questions are asked, how to prepare. And all the old timers, Dr. Pooja, Dr. Abhirami, you will remember that whenever we used to be in hostel, we had our seniors, who used to mark IMP, VIMP, VVIMP, VVVVIMP, and not IMP. So they used to tell us that this is important topic, do this first, this will definitely come in exam, and this is not important.
Yeah.
So,
Ma'am, one of my senior, just sorry for interrupting, one of my senior, she literally used to score off all the topics and chapters which is not important for the exam. And she used to say, and there was one more senior who even used to tear off the pages. He said, never go through this chapter. Never a single question will be asked from this chapter. So we'll be very happy. Okay, one chapter is missing from the book. Like that, seniors used to help us a lot.
yes, exactly. So it is depressing to see Grey's Anatomy or even BD Chaurasia Volume 3 with so many chapters where you're not understanding half of the things. So we are trying to be those seniors. We are trying to be your mentors in that way. All of them, Dr. Abhirami, Dr. Ami, Dr. Pooja, the index of every subject is telling you what is clinically important. Now, everything is important. Okay, if I am a maxillofacial surgeon, you think a respiratory or a renal physiology is not important? Definitely it is important. But certain things have more weightage depending on your specialty, depending on your profession, and depending on the type of exam that you're giving. All right. Like AIMS always focuses on clinical subjects, clinical questions, even in the non-clinical subjects. And NEET is a balanced exam. So depending on the exam, depending on your specialty, there are certain things which are important. Take help of your seniors, take help of the mentors that are there in the DBMCI family, and the IMP, VIMP, not IMP, will be taken care of very, very well. All right. And the last part is, if possible, this is a real heart to heart recommendation, something similar to what Dr. Abhirami has said. If possible, get up early. Early doesn't mean 4 a.m., 5 a.m. Okay. Ideally, yes, you should get up at Brahma Muhurat, but not later than 6. It will give you tremendous amount of energy, and it will give you will feel like you have all the time in the world. जैसे हम बोलते हैं ना, बस time ही नहीं है. We don't have time. 9 to 5 is college, then I'm tired, then I'm eating. If you get up at 6, you will have all the time in the world to do every single thing you want to do in life. You will never ever be heard saying, I don't have time. Whatever is important to you, whether it is a relationship you want to give time to, whether it is your body in the form of exercise, whether it is your hobby, which is cooking or gardening or drawing, painting, you will have time for everything in your life. So try and get up early, at least 4 to 5 days in a week, if not all. And in that morning time, in that morning, beautiful morning time, give 30 minutes to active learning. What is active learning? Study from a book. Okay, listening to videos or watching is not active. That is passive learning. Somebody is teaching and you're listening. No. 30 minutes in the morning, if possible, take a test yourself or read a very nice topic. I this is one recommendation I want to make. If possible, this is the timetable, it is shared, you can take a screenshot here, follow it. If you want to be one person who's scheduled, who is always disciplined and working hard, so this is one recommendation. And with this, I think we'll take the last passing messages from all our esteemed faculties here. Dr. Pooja ma'am, one message you would want to give to our students, one advice, one last message.
Well, I would say, since you have to start your career, focus yourself, and we are always there to help you. जैसे we say, भाटिया है तो भरोसा है. So just trust on us, trust on yourself. So obviously, success will automatically come to you. So wishing you guys all the best, and my blessings, our blessings are with you always.
Thank you, ma'am.
Yeah.
Thank you so much. Dr. Abhirami.
Yes. The difference between ordinary and extraordinary is that little extra. So if you think that you are only performing in an ordinary way, don't worry. We are there to give you that small extra edge, which will make you become an extraordinary person, not only in your first year, but we are also there to take you all the way to your NEET PG exams, INICT, and until you enter into your post graduation. So Bhatia is always there for you to guide you through. So all the best, dears. Happy learning to all of you.
Thank you so much, ma'am. Dr. Ami.
So, all the best for your new journey, your new beginnings. And we all know you will stay focused, will work hard, and we are always with you. Keep going. Whenever you need our help, we will always be there for you.
Thank you so much, Dr. Ami. And with that, I would want to conclude with 6 important points. I know the first BDS is not easy. First thing I would want to really advise is stay in a hostel or in a PG where you have friends. You will be not the only one who's in stress. You will see every damn person is under stress. And that's the biggest stress buster. All right. So try and stay in a hostel if you can. Have a timetable. Have a timetable for fun, have a timetable for movies, have a timetable for studies, for everything. Have a schedule, have a disciplined timetable in your life. Use active learning methods, use quizzes, use question banks, use applications that test your knowledge. Never hesitate in testing yourself. A lot of times students say that मैम मैंने पढ़ा ही नहीं है, Why should I take the test? Don't worry. With the test also, you will learn a lot of things. So use these active learning methods. Test your knowledge again and again and again. Check out the last 5 to 10 years university papers. Every university has a trend. Okay, if you want to perform well in the prof exams, every university has a trend. Okay, Gujarat universities, trigeminal nerve, one question will always be there. Blood pressure, one question will always be there. Carbohydrate cycle, one question will always be there. Eruption timetable, one question will also. So every university has a pattern. Take the last 10-year papers of your universities and know the pattern. What are the important points? What are the important topics? And study accordingly. In the end, in the beginning, study everything. In the end, go for the important topics mainly. All right. And lastly, to be an excellent student, you don't need many books, you don't need many sources. You need one good book, one book of your own handwritten notes, one good teacher like Dr. Pooja or Dr. Abhirami or Dr. Ami or Dr. Ashwini who's teaching you anatomy. Just one is enough. Don't think that somebody who's reading from Grace also, from Guyton also, from Sembulingam and has 10 books in his hostel shelf is a better student. No. From NEET to IAS exam to CAT, it is a rule that whatever you study nicely. 3, 4, 5, 10 times study the same thing again and again. Don't have to club in and purchase a lot of books. Whatever books you choose according to the guidance of the faculties here, choose your books in the beginning and study thoroughly. Whatever you're studying, study in depth, study nicely, and we are always there to help you in wherever whatever way you want. All right. So I think we'll end the session here. I am extremely thankful to Dr. Pooja, Dr. Abhirami, and Dr. Ami to take time and be with us for the first year profs.
Thank you. Thank you so much, ma'am. It
Thank
was
you,
pleasure
ma'am.
joining you.
Thank you
Thank
so
you.
much. Yeah.
Thank you, everyone.